Mic off. So today's topic is about the concept of rust spinning. As the name indicates, rust. This technique was described by Dr. Russ. So this is the name of the doctor who described the technique for the first time. So before going in, first we'll what is the structure of a rust pin? Structure medullary pin. Structure of venous is with one end, and the another end is having this V-shaped structure, or we can say this is the blunt end. This is how a rust pin is designed. Why this end is hooked, and what are the advantages of this end as a hook? So the first important function why this is made like this. So just to grasp outer cortex. As we know, if we put inside this one IM pin inside a mirror cavity, the pin is not outside, completely inside. But in this case, if I place this is inside the narrow cavity, some part is outside. And which is that some part? That is the hook. It means this hook is used to grasp the outer cortex. Then what is the second function? To prevent migration. To prevent migration. In case of simple IM pinning, this pin, as the dog or cat they jump from table or they jump from the staircase, there are chances under the load or body weight, the pin may migrate in this narrow cavity. Pin may come out. There are many cases I have seen that after 3, 4, 5 days, the owner complained the pin has come out. So what is that pin has come out? That is the migration of the pin. So to prevent, advise the owner to restrict the activity of your dog or your it will not migrate within first 7 to 10. To prevent this migration, what structure we are using in rust the hook. This is fitted into the outer cortex. Jump also, there are chances that this pin will come out cortex. So not only to grasp the outer cortex, but it also creation of the pin outside the narrow cavity. So these are the two. Third, to facilitate the removal. Easy to remove the rust pin after the fracture is healed. When we remove this pin, we remove usually 1 month. So the owner brings the dog or cat 1 month. And that removal is facilitated by the becomes very easy if your pin is the cortex and it is having this hook. Advantage of making this end as a hook. advantage is grasp the outer cortex. Second is migration of your pain. Suppose this is the simple I am pinning like this. This is your femur and here texture, and what we are doing here, rust pinning. So this rust pinning is having hooked. So this will give you three things. It will grasp this, prevent migration, and you can easily structure of the rust pin hooked end. What about this another end? This end. I told you this is like and is called as raven, or simply it is blunt, it is tapered. What is the purpose behind making this end as a blunt? What is the use of this end making like this? Suppose this is your femur and this is, and from here we enter. Suppose your is like this. It is not having morphology. So it will go and it will penetrate the, but what we have made, we made this end like this, so that this in contact with the opposite cortex, it will glide, it will slide or glide over this cortex. So it will just and move ahead. So this is our pin distal end as a taper or single bevel, so that when it comes in contact with the far cortex, penetrate, it will change its path, it will simply like slide like. So if pin is coming like this, it will come in contact with far cortex and it will. Why it is sliding? Because of the end we have made. So if the end is not like this, it will come and penetrate. So this is advantage of making this end like to prevent far cortex penetration. Far cortex penetration. So this was about the structure of the that was described by Dr. Rush. The proximal end and about the distal end. Then size. What size of rust pins available? So 32 and 3 by 16 inch and make it half 1 by 4. These are that available in this size. But at present this rust pin concept is rust pin is obsolete, not rust pin concept. So what we are using in even in IVRI we do. So what we have in place of rust pin, we have K wire. K wire will solve the purpose of the rust. What are K wire? They are nothing but small diameter. Steinman pin is or simply IM. If it is in small diameter, thin, elastic, then we call it K. Pins which are available previously they were available as like this. In these four sizes they are not available. This rust pin. So what we are using KY. So this was about the structure. What is the mechanics? What is the biomechanics? Why we are using a rust pin? What it is giving? What purpose? What forces it uses? Biomechanics of 3 points about the biomechanics of the rust pin. The first, it provides 3 point wide 3 point fixation. Action without filling medullary canal lately. The rest pin. So we can say pin provide 3 point fixation loaded action with cavity completely. Then points. One second. So first is the meaning of 3 point fixation. Compare the IM pin. Suppose this is the femur. IM pin. IM pin. Then we enter our fossa and so this is the simple. Whether you retrograde or retrograde. After going up, we cut the extra pin. We cut the, so in the pin is filling is filled completely. The case of rust pin is supracondylar fracture and you are in case of rust pinning. In the third point I wrote that was without medullary canal completely. That was the third. In case of rust pinning, we do not fill this medullary cavity. As in this case, medullary cavity, if it starts from here, if medullary cavity is completely filled with the pin. But in case of rust pin, medullary cavity filled completely. Means rust pin, they end somewhere up to here. This was the first point. Third, second point, first point was 3-point fixation. What is the meaning of 3-point fixation? In case of IM pinning, we see this is the proximal diaphysis, this is diaphysis, cortex, and this is the distal metaphysis. Number 1, 2 and 3. I am pin the rest pin is also. This is point number 1. It is filled with the cortex, and this is the point 3. So these are the 3 points where your rest pin or as a simple IM will be sitting. If it is IM pin, proximal metaphysis, cortex metaphysis. If it is rest pin, this is metaphysis, then cortex, and this is proximal part. At 3 places our pin is sitting, so we call it fixation. So the definition of the rest pinning: 3-point fixation under spring-loaded tension filling medullary cavity completely. 2 points over medullary canal completely. Second point, it is the third point is what is the meaning of loaded tension or simply spring action. This is the important point which differentiate your IM pinning from the what is the meaning of the spring loaded action? Of the rest pin is your femur and this is the metaphyseal fracture. Okay. If you are doing rest pinning, like this, like having something blunt head. So this of pin will act as a spring. So this spring action, what we call elasticity. It means is there, you have done rest pinning. After this, when it means when body weight, that is also called as load. When you apply load or the body weight of the dog or cat, that body weight will come like this. But when with this weight is coming, this load is coming, these will act like spring. So fracture point will. So they say that the spring action more will be the stability. Less will be the stability. When the angle of insertion is 30, when the spring action is less, when the stability is less, when angle degree. Next point, explain the meaning. But try to understand this concept. Spinning gives you spring action. They cross each other in the form of a if the body weight of the animal will compress this bone to the fracture line. But above what we learned of the rest spinning, they have crossed like this. So this it will act as a spring. Because the pins are elastic, they will give you spring action. Because of
Hello?
this spring action, it will give more.
Hello?
Hello.
Sir,
Hello.
your board is not visible. Sir, your board is not visible.
Now.
No, sir.